thanks everyone for coming along to the first meeting of the Health and Wellbeing Social Enterprise Network. I hope you've all been enjoying this semi-decent weather we've had, and hopefully a little bit more of that is to come. Hopefully we've not seen the back of the summer yet. So I'll just introduce myself. I'm Aimee, and I'm the membership officer here at Social Enterprise Scotland. Joining me is Jane, who's the membership manager. So we make up the membership team, basically. I'll give you a little bit of background as well for anyone who doesn't know who Social Enterprise Scotland are. So we're the national intermediary and membership organisation for Scotland. So we're member-led. We're here to support, inform, connect and promote social enterprise within Scotland. Members are at the heart of everything that we do, and we try and make sure that it's the members that inform everything that we do going forward. We're free to join if your turnover is under 250,000 per year. And then we charge on a sliding scale after that. We would love it if you would join us if you haven't already, either as an emerging member for startups and sole traders, a supporter member, or as a full social enterprise member. And we will share the link to the membership application at the end of this session, or you can find it via our website. So just a little bit of background on the network and kind of the reason that we've decided to do this. We decided last year to establish thematic networks based around specific areas of interest within our membership. As you can imagine, because of the way the sector is, we have a very diverse membership made up of different industry sectors, beneficiaries, business models, and social impact across multiple regions. So we thought it'd be useful to set up these networks based around 4 different themes. So we've got this one, which is the health and wellbeing one. We have a sport and outdoor activity network, one based around employability, and another around community spaces. As many of our members work within the health and wellbeing sector, we thought it was a good idea to create this network as a kind of platform for you to explore topics of interest, hear from key speakers, and create opportunities for connection and collaboration. This is really your network. I really want to stress that. So it's up to you kind of how we go forward with this. We're looking to meet maybe 3 or 4 times per year, and we do have some scope for some in-person community learning exchanges as well, which could act as a kind of time for us to come together and look at some other organisations that are doing good things. The purpose of this specific session is to explore the topic of health and wellbeing within the third sector and look at areas of focus and development for the network going forward. So we're going to hear from a guest speaker who's going to share their experience and expertise around the topic of health and wellbeing. So I'm delighted to have with us Rhona McMillan from the Alliance, who are the national third sector membership organisation for the health and social care sector. So obviously loads of experience in the room. We will have a bit of time after Rhona has presented for questions. If you have any burning questions for Rhona before that point, then you can post them in the chat and we'll get to them afterwards. But it would be good if while Rhona's talking, we can kind of think up any questions that you have, and we can discuss that at the end. We are then going to go into some breakout rooms so that we can gather some feedback on how this network should be. How would you like the network to run kind of going forward? So that will be the second half. And then we're going to feedback after that what you've talked about in your breakout rooms. So just a bit of housekeeping now before we begin. If you could keep yourself on mute unless you're speaking, then that would be ideal, just to get rid of the background noise. We are going to record the presentations, but not the questions or the breakout room. So if you'd rather not be in the recording, then you can turn your camera off for the presentation. But obviously it's nice to see all your lovely faces. So I think we'll just begin there. Rhona, is it okay if I pass over to you?
Yeah, sure. I'll just share my screen. Just bear with me. Yeah. Okay, so hopefully everyone can see those slides there. So hi everyone, thank you very much for having me this afternoon. My name is Rhona McMillan. I'm a Senior Development Officer with the Alliance, and I'm delighted to take the opportunity today just to share a bit more information about who we are and the work that we do at the Alliance, and also how we may be able to support you today. So just by way of a quick introduction, the Alliance is defined as a national third sector intermediary, and really what that means is we're a membership organisation. So we bring together quite a diverse range of people and organisations who share our vision for a Scotland where everyone has the right to live well with dignity and respect. So we have over 3,500 members, ranging from your kind of large national charities, that you might have heard of, like British Heart Foundation, McMillan Cancer Support, right through to kind of volunteer groups who are maybe only made up of one or two members. We also have members who are professionals working in a range of different roles and capacities across health and social care. And crucially, our members are also people living with long-term conditions, disabled people, and unpaid carers. So we work with our members and our partners to ensure that lived experience and the expertise of the third sector is listened to and it's acted upon by informing national policy and campaigns, and really about putting people at the centre of how support and services are designed. So we have three kind of overarching aims that really inform our portfolio of programmes across the Alliance and how we work with our members. So firstly, we want to ensure that disabled people, people with long-term conditions and unpaid carers, their voices, their expertise and their rights drive policy and sit at the heart of design, delivery and improvement of support and services. We want to support transformational change by working with individual and community assets and helping people live well by supporting human rights, self-management and independent living. And finally, we want to champion and support the third sector as a vital and strategic delivery partner and really foster kind of cross-sector understanding and partnership working as well. So we do have a range of programmes across the Alliance. I'm not going to go into all of them, but I really just wanted to give you a bit of a flavour of the different spaces that we occupy and the scope of the work that we're doing. So first up is our Community Links Worker programme. Our Links workers are based across GP practices in Glasgow and beyond, and they would work with patients on things that might not be something that patients would bring to a GP, things that a GP would deal with, but would absolutely be impacting someone's health. So for our Links workers support people to engage in support around housing and homelessness or kind of money advice, food insecurity. They link people in with community groups and different health and wellbeing activities. So absolutely those things that will impact a person's ability to live well or do any kind of thing, our links workers will work with them on that. So we started off with, I believe, eight links workers, maybe 10 or so years ago. I believe we now have over 80. So a really, really important programme there. Self-management, I know that many of you will be familiar with that term, but self-management is very much about living well with a long-term condition, being in the driving seat, and working with partners, and working with health and social care partners in partnership and being recognised as an equal partner in the management of your health. So our self-management team manage a national network connecting organisations and individuals to drive forward self-management as a kind of culture change. But we co-produced Gone Yourself, which is way back in 2009, which is Scotland's long-term condition strategy. And I believe that the first Scottish Government policy to be fully co-produced by people with long-term conditions. And now we're administrators of the Scottish Government Self-Management Fund. So we support third sector and community-based organisations to develop self-management activities. We've just announced our recent tranche of grantees to the fund, and there's some really exciting projects in there that are really developing people's capacity to live well and self-manage. Our digital health and care programme is a significant work stream that explores digital and innovative technologies and ways of working, both from the perspective of kind of systems, but also citizens and how someone might use tech to manage their health. One programme within that directorate to highlight would be ALICE. So ALICE stands for a Local Information System for Scotland. This is a database or a directory where you can search for health and wellbeing services and resources within your community. If you operate a service that you'd like people to find, please do consider adding it to ALICE. But if you're looking to find community services as well, it's a great way to find out or get sense of what's in the area. So you can filter by postcode or by category. You can also create personalised lists for people. So definitely worth checking that out. And then our Children and Young People programme, this is the programme I lead on, so please excuse me, I'm going to get a bit of a shameless plug in here. The Children and Young People programme is focused on raising awareness of developments across the children and young people policy landscape. A large part of my role is to work with professionals and organisations to look at how they can increase their capacity on how the Scottish Government Scottish Government policy GIRFIC is implemented within their local area. So there's, as I say, a range of different programmes, and I'm not going to touch on these for too long, because what I really want to move on to now is how we can work with you. So, as I said, the Alliance is a membership organisation. We really aim to harness that collective voice to make positive transformations across health and social care. And I often think that because we kind of occupy that space, in that intermediary space, we sit between policy and implementation. We can support our members and the others across our networks to really connect the dots, if you like. If you come to us looking for support, if you're maybe got a training need or you're facing a challenge, or you're looking to connect with others working in a particular area of focus, we might not have that specific answer, but we have over 3,500 members that we can get that answer from for you. So it's really, we have those networks and structures in place. In addition to the kind of opportunity to feed into the development of policy and practice by attending our engagement events and meetings, we also hold a range of networking sessions. So a great way to connect with others working across health and social care. You can also promote your work on our channels, our social media channels, our website, our newsletter. So again, it's really just about having that access to tap into those much broader networks and groups as well. We also offer training and webinars. So again, if there's something you're looking for support with, our membership team are really responsive to that. So, for example, I was recently having a conversation with a colleague who was noticing that the current volunteer recruitment crisis is sort of massively impacting how they're delivering one of their services. And I spoke with our membership team about that. They then partnered with Volunteer Scotland and we kind of developed a little session about that. So it's really about being responsive to those needs. And I won't stay on this slide for too long, but if you do want some further information on our membership options and kind of how you can work with us, please do scan the QR code for more details. I've also shared these slides with Aimee as well, who can hopefully share them after the meeting as well if there's any follow-ups there. And finally, as I mentioned, a large part of our work is championing the third sector as a vital strategic and delivery partner in health and social care. There's so much fantastic work that our members do across the board, across the third sector, and we're always looking for ways to kind of promote and raise the profile of that. So I just wanted to draw your attention to some projects. These are projects funded through our self-management fund and are also social enterprises. I don't know if anyone is on the call today that's associated or works within these organisations, or if everyone's already familiar with them, but Indigo Childcare Group, triple award-winning social enterprise that provide child care and after-school care. They also operate a mobile creche. They've been funded in the most recent rounds of our self-management fund to further develop support for carers of early years children on the spectrum through training, peer and one-to-one support and stay and play sessions. Clydeside Community Initiatives, a well-established organisation I'm sure many are familiar with. They have a number of social enterprise activities, including Langloch Farm. They've been awarded a small grant in last year's round of funding for a piece of work that was looking at ways of better reaching and supporting individuals with certain mental health certain mental health conditions. And finally, Teen Plus, who are based in Edinburgh, I believe, are being funded to specifically look at supporting young adults with long-term conditions to explore developing their own enterprise activities. So a real range of different organisations there, which is a bit of a flavour of the work that we support. So this has been very much a bit of a whistle-stop tour to the Alliance and the work that we do. In terms of those on the call today, what I really just want to impart is that we're always looking to connect with new people and organisations working across health and social care and explore how we can work together. As I said, we do have these networks and structures in place for our members that are available to tap into to support your work. So if this has been of interest, if there's anything you'd like to follow up with, please do get in touch. We'd be delighted to chat further. And if anyone has any questions today, I'll hopefully be able to answer those. But thanks very much. I'll just stop sharing my screen now.
Thanks so much, Rhona. That was really, really useful just to get a kind of flavour of what the Alliance do, particularly for the third sector. But thanks everyone for coming along, and thanks particularly to Rhona as our guest speaker today. We will share this recording along with her presentation and her email address for anyone who wasn't able to make it along, and in case anyone has any other questions. If you'd like to join, I think most of you will already be part formally of this network, but if you would like to join the network, then if you're not a part of the network and you want to join, I'll add that to the chat just now. Just means that you can stay up to date with any of the future sessions that we run. And then I think finally, if your organisation isn't already a member of Social Enterprise Scotland, then we'd love for you to join us. I don't know if you've posted that up, if that's been posted in the chat already, but I'll just post the membership link as well again, just in case. And yeah, it's quite a simple form as well and doesn't take too long to fill in. Well, so I think just to finish on that and just say thanks everyone for coming along. Thanks for all your contributions. And yeah, we're going to hold these a couple times a year, 2 or 3 or 4 maybe times a year. So keep an eye out for the next session when it comes, when we've got a date. Have a lovely rest of your day and hope to see you all again very soon.